Greetings, everyone, and welcome to Beyond Connections, Rural Georgia premier medical and health professional radio network. This is MedTech. I'm your host, Frank Baia. Today's guest, we're greeting Chris McKinney. Chris is the Associate Vice President for Innovation Commercialization at the Georgia Regents University. Chris, welcome to MedTech.
Thank you. I'm so glad to be with you, Frank.
Well, probably most of our listening audience have a general idea, but maybe get down a little bit into what we call the granular about what can universities do to help advance the cause of rural health care, and especially through innovation.
Well, you know, universities have a huge mission around teaching, around education, around research, and around service. But I think we particularly have an opportunity to serve the public better in that rural healthcare environment. We do research to advance the state of knowledge, but we also do clinical care. And the great news is we put those together. We put advancing knowledge and clinical care into the same vein of developing the next products or services that can change the world.
Well, innovation, certainly a dynamic term that's used almost too frequently, I'm afraid, in terms of sometimes not necessarily identifying much more than, say, high tech. And I guess one of the things that I'd be curious about is, from your perspective, is this innovation that you're talking about all about high tech, or do people figure into the equation?
Oh, people play a major role. I mean, the innovation does have a high tech feeling to it, but the high tech really works when people are front and center, not just in implementing, but in developing and conceiving from the outset.
I had a fascinating experience over the weekend, something that was, at first I thought it was a little abstract and kind of was curious about it. It was called the National Day of Civic Hacking, and they actually brought together, by crowdsourcing, individuals that weren't necessarily, high-profile programmers or successful technology entrepreneurs, but it was the Peace Corps looking for new ideas and innovation of what they could do for their own outreach. And you talk about rural outreach, of course, we're talking in some cases third world countries, in fact, in many cases third world countries. So where I'm going is I think the people factor plays such a major role, not only in the implementation, I would even submit in the embracing of innovation, because in a lot of cases, sometimes there's a resistance, especially from a rural perspective, in adopting innovation simply because it's such a cultural change. But the other side of it is good ideas come from people that are brought together, sometimes from unique sources, to come up with these things. Certainly that's something you guys experience throughout the university system.
Oh, absolutely. The people factor is essential in making the innovation matter. And in fact, the people factor is what helps us drive what innovation is needed. We really do want to do things that at the end of the day have an impact. Really?
Well, let's talk a little bit about, we were talking about people, but let's go back for a minute and talk about the obvious situation, and that's the whole concept of high tech. I remember there was a country song about Mayberry meets Star Trek, kind of a thing. Let's talk a little bit about the impact of high tech on rural health care. Good, bad, talk a little bit, and certainly this one's a reach, but just over the next few years, but maybe even look a bit further ahead to the coming decade.
Well, sure. I think, we're finding that the high tech in rural health care is all around getting closer to the patient. Such things as telemedicine, telehealth are making a difference because we can bring medical care, specialized medical care, much closer to the patients in the rural areas.
Well, you obviously sound optimistic about the impact of it. I think that the blend of the cloud technologies, telemedicine, some of the communication capabilities, certainly digital communication capabilities, play so well from a local standpoint, and I say local meaning the metropolitan areas and major markets, and they provide a certain level of efficiency, certainly a great contribution, a value proposition in terms of being able, in the concept of telemedicine, to provide abilities that may or may not be even available in a metropolitan area. But let's talk about it in a rural setting. Why the optimism? I mean, is it because it's almost the perfect storm? It's exactly where it fits, or from your perspective, why? Why is it so much of an impact on the rural setting?
Well, I think we have a lot of opportunity to improve the care in the rural setting. I mean, historically, you had to travel to health care. Now we're bringing health care to you, which means a lot of people are having care sooner and more often that is of a lesser degree than is difference. And at Georgia Regents, we're also very focused, I should mention, on preventive care. So it's the mix between what you might call sick care, treating illness, and health care, really preventing illness in the first place.
Well, I think one of the things that from a private perspective, private sector perspective, I think that, well, from an altruistic, you want to look about a healthy community, as you point out, being preventive as well as serving the existing population to make sure that even in the most remote areas, especially obviously of Georgia, that they're getting equal attention, equal capability, equal care. The other side of it is that fundamental to the economy expanding in these marketplaces is having good health care. Inbound investment, the kind of things that they're looking for in terms of creating jobs and opportunities, are tied directly into the consideration of all things. What's the cost of living? What's the educational situation? Also, what's the healthcare situation in a particular market before I'm going to relocate my plant or operation into that area to create jobs? So talk a little bit about, in general, healthy communities as it relates from your perspective, the medical component of it, but then the infrastructure aspect of it, providing this kind of value-added proposition as a competitive advantage for that community from an economic development standpoint.
Well, that's an essential point, that healthcare and the community quality of life are just inextricably tied. To the extent we provide better healthcare, better not only treatment of conditions but prevention of illness and behavioral guidance that help people avoid those problems, we make our rural communities not only better places to live, but much more attractive for site selection consultants, siting companies,
sure,
or for people to relocate, or for investors to invest.
Well, one of the things we're doing on MedTech that we're going to ask each one of our guests, obviously over the course of the programs, we'll be talking to an eclectic group of administrators, physicians, implementers of technology of one kind or another, and I think getting we say a 40,000-foot perspective is just going to be an interesting exercise in terms of kind of prognosticating what's going to be going on over the next few years, the next decade. So my question is, our audience wants to know, what is the one big thing you think will really change rural care in the next few years? Why do you think that'll be it, and why?
Well, I believe that telehealth, telemedicine is going to be one of the most transformative aspects in rural healthcare in the coming years. And I think that's number one. We're doing it out of places like GRU and around Georgia. But also, I think the emergence of electronic health or medical records is a great enabler to telehealth, telemed, point of service, which in the telemed concept is out where the patients are.
Well, we've been speaking to Chris McKinney, and Chris is the Associate Vice President for Innovation Commercialization at the Georgia Regents University. Chris, thank you for taking so much of your time out of your busy schedule to spend a few minutes with us on MedTech.
Well, thank you, Frank. I enjoyed it.